As far as brushing at home, we're going to recommend that they're in there with a toothbrush. If the patient is under 2, we're not going to have any toothpaste at this point in time. Okay, dependent on the risk. If they're a really high-risk baby, on some occasions, might have them put a little bit of fluoride toothpaste on their fingertips and kind of rub it in after they've brushed. But for the most part, it's just a wet brush twice a day. And I need, if it becomes a real aggravated fight, I need that parent and them at least at nighttime. That's the most important time. The baby might be able to get a chance when they're more of a toddler. They can brush a little bit in the morning themselves, but I need hands-on with the mom or the dad, however that works. If we're grazing, make sure we're not grazing on fruit. Make it well-defined. Have cheese, pretzels, something along with that fruit. We want to diminish the frequency that they're being exposed to that fruity sugar. Milk, let's not graze on the milk either. The water needs to be in the sippy. And we also ask them about their water source. Is it a city water? Is it a community well? Some of the community wells, I have in a Rolodex, some of the results that we've had from previous kits. We keep test kits in our office as well. That way we know what that child's getting. And sometimes they have certain sources, those big 5-gallon jugs of water that usually aren't fluoridated. Sometimes on occasion we actually have the parents test or get in touch with the person that bottles that water. Some of the companies have that available to them. And then bedtime routine. What is the bedtime routine? Are we brushing right before we go to bed? Are we having sips of milk afterwards? Is it after their last bottle? We need to make sure they're going to bed clean. I don't want any residual milk in there. If you can possibly, some of our nursing moms, what we usually recommend, have that last nursing at nighttime and then just kind of wipe out. Or if it's in the middle of the night, have them wipe best they can. And little sips of water afterwards, but we want those clean teeth at bedtime. Nothing but the water that goes, they can have a bottle in bed, but it's got to be the water inside. And sibling order. When they come in for their appointments, if they are sibling number 3, then I always have their charts out already if it's the first time that I'm seeing them, because I've already interviewed the parent. I've already counseled them on certain things. I know what the family's risk is going to be, so that way I can kind of pinpoint where we might need to work.